I frequently talk to patients about the relationship between their diet and their fertility chances. And we know that things like the Mediterranean diet is supposed to be better. The kind of Nordic diet is supposed to be better, like the Dutch diet, that kind of thing. So there are some diets that have been shown to be beneficial, but I actually haven't seen one kind of grouped together meta-analysis like this on the relationship between diet and miscarriage. Now, we get asked all the time, what should I do to prevent a miscarriage? And, what should I eat and stuff like that? And I generally was telling people just eat healthy, a normal balanced diet, rich in fruits and vegetables, and try and minimize your exposures to high sugars, high cholesterol, red meat, that kind of thing. But that was just like common sense. There wasn't data behind it, but this is actually data to support certain approaches. So these studies, so actually not a lot of studies on this topic. 11 were cohort where they followed a group, 9 were case control where they compared people the outcome and then looked at their dietary habits. And then they said 6 were suitable for meta-analysis, 2 cohort, and 4 case control. So they really whittled it down from 20 studies to just 6. So automatically you lose 14 studies worth of data. Excuse me. Nevertheless, this still included 13,183 women, which is a lot of people. And that provides us with really robust data. And you can get reasonable conclusions when you have those kinds of numbers because the statistical significance automatically gets much, much higher than normal. So what did they find? Well, it's all here, but I'm going to go through it with you in chart form so that we can go through it and explain it all to you. So bear with me while I scroll through 15,000 pages here as we get to the end. And this is a pre-proof article, so it hasn't been published yet, but it will be coming soon. Okay, we're still sharing? Okay, so this was for the cohort studies initially. And what they showed here was that in these cohort studies, if you took fruit, and I know you can't probably see all of these well, but the first one is fruit, you had a very significant reduction in miscarriage. You were down to just 39% of those that did not have a high fruit diet. So a significant reduction, a 61% reduction in miscarriage rate if you had a high fruit diet or a diet high in fruit. For the people that were taking lots of vegetables, very similar. They had a very significant, a very significant decrease in risk, 41% in this group. Again, very significant, obviously makes a big difference, and you are achieving a much lower miscarriage risk if you have a diet that is rich in vegetables. When they combined fruits and vegetables, again, a 37% risk in a diet that was rich in fruits and vegetables. Again, highly significant. So everywhere where you see that red diamond and it's not touching or crossing that middle bar, it means it was highly significant. So that's very, very beneficial. Meat, they actually didn't show. Now, they suggested that there are some studies that look at meat and show that it increases your chances of gestational diabetes, your chances of preeclampsia during your pregnancy if you have a diet that is too rich in red meat. But they did not show a definitive change in miscarriage risk. So if you feel like steak, you can have a steak. Is it good for you? No, because it causes colon cancer. And like they said, there's higher cholesterol issues. There are risks of preeclampsia, diabetes, but it's not going to increase your risk of miscarriage. So if you're worried about it from a miscarriage perspective, don't be worried. It's safe to take. And the same thing for red meat versus all meat. White meat, which included chicken and fish, it was right on the border of significance. So it touches one, but it's close enough that there likely is a benefit to taking white meat. So if you're having something like chicken, it might reduce your chances. In this study, they were suggesting by 20%, but it's not statistically significant technically. Seafood definitely decreased your risk, 19% reduction, and that was significant. So if you have a diet rich in seafood, then it's going to benefit you. So this kind of flows back to the Mediterranean diet. which is lots of grains, lots of seafood, lots of fruits and vegetables. So that diet does look like it's not just beneficial for getting pregnant, it's actually beneficial for also staying pregnant. And this is data, like I said, we have not seen before. Dairy products, for those of you that are worried about hormones and exposures and stuff like that, it's actually quite a significant reduction in risk if you are taking dairy products. So 37% reduction in your risk of a miscarriage if you have a diet rich in dairy products. And there were multiple studies involved in that, almost all of which showed a benefit. There was just one that did not, and that was done in Algeria. So, and that was the smallest of the studies. Eggs, also significant, and I never would have imagined that eggs would have a significant role, but if you've got a diet that's rich in eggs, 19% reduction. So the big question here is, what do vegans do, because they're not having dairy or eggs or meat? So I don't know. I have to actually sit down and now research whether vegans have a higher or lower risk of miscarriage. Based on this, I would anticipate maybe they do have a higher rate of miscarriage. So that's something that we need to explore. I don't know it, so we'll have to check it out. Cereals and grains, like I mentioned earlier, 33% reduction, so 1/3 reduction in your miscarriage risk. Again, that's huge. Fat and oil, neutral. It didn't show a risk at all. Sugar substitutes kind of trended over to a higher risk, but it wasn't significant. So all of this, super important, all demonstrating that there is an impact on your miscarriage risk from your diet. So the key findings here, again, the ones that I kind of summarized there for you: fruit, vegetables, obviously fruit and vegetables, white meat like poultry, seafood, dairy products, eggs, and cereals and grains, all beneficial, okay? Red meat, we don't know. And none of the dietary changes increase your risk. So again, we're not blaming anybody here. This isn't about saying you had so-and-so, so it increased your risk. We're actually talking about things that can decrease your risk, so we want to focus on that. When they looked at the cohort studies, that did present slightly different numbers. So the fruit was very, very significant. Again, here you're looking at 61%. Vegetables, again, very significant, 41%. But when they combined fruits and vegetables, it was only one study. It did not show a difference in this case control study. Meat, a little bit more trending towards a risk. Red meat, same thing, kind of a little bit more trending towards a risk. White meat did not show a benefit there in the case control study. Seafood still positive. Dairy products still very positive, a 43% decrease. Eggs still positive, a 30% decrease. Cereals and grains, a 43% decrease again. Fat and oil, no difference, but sugar substitute had this insane increase in miscarriage risk at 7.5 times the baseline risk. So if I flip back to the other one, you can see it was a suggestion in the cohort study. It kind of trended that way, but it was not significant because it crossed that bar. But in this case control study, there was this massive increase with sugar substitutes. So if you're thinking about having sugar-free drinks or, sugar-free pop or something like that, don't. I can't tell you that this is enough data to kind of put the nail in the coffin of those substitutes, but I certainly wouldn't take it based on how significant a risk this demonstrated, because we know that they're generally speaking not particularly good for you, and certainly in this circumstance probably should be avoided. So if you need to have something with taste, and you like as a drink or as a something that you want to eat, and you're trying to avoid high amounts of sugar, just look for low kind of sugar fruits, things like strawberries, and focus on those. And if it's in a drink, just dump some fruit in your water. You're going to get minimal sugar from it. You'll get the flavor, and you're getting all the benefits of the water plus whatever vitamins your fruit releases. So that's probably a much safer way rather than trying substitutes, so that you can have a can of Diet Coke or anything else like that. And then they did kind of summarize it with these dietary patterns that they looked at. So in their dietary patterns, when they looked at the prior data, an a priori analysis. They actually didn't see any differences with anything until they got down to the bottom ones down here. So they got a prime diet quality score, and it's a specific type of diet that they were looking at, and you can find these online. I won't get into them tonight in too much detail. That did show a reduction, and that reduction was very significant. You're looking at a 47% reduction. The dietary inflammatory index, so if you were taking diets that were potential, there was a 2.12-fold increased risk of miscarriage, and that was significant. If you had a high antioxidant diet, so again, lots of vegetables, lots of fruits, lots of vitamins, you were looking at a 57% decrease in miscarriage. A balanced diet in the kind of post hoc analysis, 27% decrease. And the processed diet, again, showed this twofold increase in risk of miscarriage. So if you're taking foods that are heavily processed, processed sugars, processed fats, things like that, you're going to end up with a higher risk of miscarriage. So is it a fact or fiction that your diet can actually impact your miscarriage risk? It is actually a fact. I can stop sharing, I guess, if you want, or you can stop sharing. So it is actually a fact. It does very much look like your diet can control or at least contribute to your miscarriage risk. And therefore, it does need to actually be factored in to your decision process in terms of what foods you choose to have, what diet you choose to follow. As a general rule, while you're trying to get pregnant, we do advocate for that Mediterranean diet. Fresh fruits, vegetables, reasonable non-seed oils like an olive oil. Focus on having fish rather than meat if you can. Some eggs, some dairy, that's all going to be very reasonable for you. There are people out there who believe that dairy is the devil and that it causes lots of inflammation. There are studies that do support that. I don't question that. Nevertheless, this study is showing that it does reduce your miscarriage risk. And I think a diet devoid of dairy is probably not necessarily a balanced diet. So there are things here that are important to learn from, and hopefully that'll help you guys in your journey moving forward. Do I think that this is the be-all and end-all of miscarriage? No, of course not. Remember that 60 to 80% of miscarriages are caused by a genetic problem. It won't make any difference what your diet is if it's a genetic problem. So don't blame yourselves. Do not hold yourselves responsible, but certainly make good choices moving forward so you can get to where you want to go. I hope you enjoyed that segment. Let us know your thoughts. Make sure you like, comment, and share. We always appreciate the comments. It helps us get better and better all the time. And that's it for that part.